Hello and welcome to my channel Magic of Medicine. Today we will read about floating aorta sign. It refers to displacement of aorta away from vertebral column. It is seen whenever there is a mass, a retroperitoneal mass to be precise, between aorta and vertebrae. So obviously the mass will push the aorta anteriorly and displace it away from the vertebral body. As we know, normally aorta abuts the vertebral body, but if a mass comes in between aorta and vertebral body, it will be seen anteriorly displaced, and this sign is interpreted as floating aorta sign. So what are the differentials of floating aorta sign? Differentials include any retroperitoneal mass, the first differential being lymphoma. Others are lymph node metastasis, retroperitoneal sarcoma, retroperitoneal fibrosis, etc. So, although it can be seen in any retroperitoneal mass which comes between aorta and vertebrae, it is classic of lymphoma where the aorta truly seems floating within a soft tissue, that is, there's floating aorta without significant luminal narrowing. So, true floating aorta sign is when there is no luminal narrowing of aorta, and it is classically seen in lymphoma patients. So, coming to the X-ray findings. On X-ray, lateral lumbar spine radiographs will show clearly displaced aorta, which is measured by two methods. Either measure the distance from anterior margin of a spine to posterior wall of aorta, or measure it as anterior margin of a spine to anterior wall of aorta. So normal cutoffs are less than 10 mm in males and less than 7.3 mm in females whenever you measure till posterior wall of aorta, and less than 40 mm in males and less than 37.3 mm in females whenever you measure till anterior wall of aorta. So if you find the distance increased, it is suggestive of floating aorta. And next you will advise CT abdomen. So now I am showing you a radiograph where this is aorta outlined by my pen in white color, and you will measure either the distance from anterior spine to posterior wall of aorta or anterior spine to anterior wall of aorta, and the cutoffs I have already told you. So coming to CT, and more precisely CT abdomen, is the investigation of choice. So on CT, you will see prevertebral soft tissue which is lifting aorta away from the spine, and there is no lumen narrowing encasement. This is the main point which you have to remember. So on this CT image, you can see there is a prevertebral soft tissue density mass lesion lifting the aorta away from spine. However, there is no significant luminal narrowing, which is suggestive of floating aorta sign. Another CT image, it also shows a homogeneous soft tissue density prevertebral mass lesion lifting the aorta away from the spine. However, there is no significant luminal narrowing. So this also appears as if the aorta is floating in the soft tissue mass. So this was all about floating aorta sign. This can be asked as a OSCE question, wherein they will give you an image of CT abdomen, and you will see aorta is floating in the soft tissue prevertebral retroperitoneal mass without any significant luminal narrowing. So first step is to diagnose, and then second you have to tell the differentials, amongst which lymphoma should be your first differential. Third, they can ask you, can you suspect this entity on X-ray abdomen? So you have to tell, yes, we can suspect this entity on X-ray abdomen, more precisely on lateral lumbar spine radiographs, where we can measure the distance from anterior margin of spine either to the posterior wall of aorta or till the anterior wall of aorta, and there are specified cutoffs 10 mm and 7.3 mm for posterior wall of aorta and 40 mm and 37.3 mm for anterior wall of aorta for males and females respectively. And fourth question in the OSCE can be tell other floating signs. So you can tell floating teeth sign and floating membrane signs. So this was all about floating aorta sign. Thank you for watching the video. Please like, share and subscribe if you found the video useful.